Welcome.
Welcome.
Welcome to
Welcome. We have your thriving tips.
Welcome to Trips to Thrive.
Trips to thrive. I like that. Welcome. Tips to thrive.
Oh my God, I have the worst bruise under my eye after that tear trough injection.
What? I never bruise anyone. What are you talking about?
I mean, what are you going to do about it? I can't be seen. I have a date tomorrow night.
My patients don't bruise. But you know what? You can come in and see my fellow.
No, but honestly, who does the follow-ups? If a patient has a bruise, who sees that patient?
So generally speaking, my follow-ups, I really like to send them to my fellows or one of my extended providers if I can. If it's a serious issue, of course I'm going to see the patient.
Yeah, I agree. So presently we have our fellows see any bruising after a procedure, and then if there are any complaints, maybe after a neuromodulator injection, if there's a little bit of asymmetry, it's also an opportunity for our fellows to get more hands-on experience and also be able to touch those patients and screen them for us.
Okay, but how do they know if it's a serious issue or not a serious issue?
And so at that point, if there's any pain after injection that's like not, consistent with what you should see after an injectable, or that could signify potentially an infection after laser resurfacing or even lipo, then the fellows are able to grab us because we are still in the office, obviously, to be able to support them.
Do you charge them for these treatments?
We do not charge. So any type of bruising or any type of follow-up after a treatment if the patient is not satisfied is complimentary.
Even a touch-up?
A touch-up with neuromodulator is, for filler it is not.
So you don't charge them to do a filler touch-up?
No, because it's clearly delineated in the consent that if there is any type of asymmetry that they may need more, and that is at their cost.
Oh, so they pay for it?
Yes.
Okay, so I'm going to give the 3 tips here, and it seems to me the 3 tips on follow-up to a patient after you treated them. Number 1 is try to delegate it to someone who's well-educated. I think that's going to be the second tip, is that this person's got to be well-educated.
Correct.
So number 1, try to delegate it, save you time. Number 2, make sure they're well-educated and they know how to get to you if it's a problem. And based on what you're saying, the third tip here seems to be like, you're going to charge if they're asking for a lot more.
Yes.
Okay, so be price conscious, price sensitive, but consider the bottom line as well with some of these patients.
Perfect.